VC is a 25-year-old man with a problem. His girlfriend left for a girl's Miami trip and left him alone for a week. After a few days, VC became bored and horny.
I did it because I was bored.
So he decided to stick his penis in a vacuum cleaner. Now wait a second, let's be real. As a man, you either try to do it or you're lying. The force of the vacuum was strong enough to basically Jewify him on the spot, and after 5 hours of asking ChatGPT what to do, he decided to call
911, what's your emergency?
At the emergency room, he told the admitting nurse that he had an accident during intercourse with his girlfriend because he couldn't think of any other explanation for how the injury happened, and was also too ashamed to admit he stuck his wiener inside a Dyson. You have to remember, tell nothing to the police and everything to your doctor. Although VC was bleeding pretty heavily from his groin area, he decided to aura farm and act like everything was okay because the nurse that admitted him was a certified baddie.
You what?
This is one of the reasons the nurse hotness scale must be introduced in the hospital system. What is a nurse hotness scale, you might ask? It's a scale that determines which nurse can or cannot be employed by a hospital based on her attractiveness. The scale is comprised of several attributes such as thigh thickness and the waist to gluteus ratio. Each attribute is delivered 1 point, and if you pass 5 points, you cannot be employed by the hospital. The Nurse Hotness Scale, or NHS, is already implemented in more progressive societies such as Afghanistan, where nurses cover themselves in dark clothing so they can be more easily employed in the medical field. In order to understand how VC's got damaged, we need to look at the anatomy. The penis has 3 cylindrical structures running through it. 2 corpora cavernosa, which are the erectile tissue columns on either side, and the corpus spongiosum, which surrounds the urethra underneath. The vacuum cleaner changed this arrangement by generating massive negative pressure that forced blood into the erectile tissue far faster than it could drain it out. The tissue becomes engorged, swells further, and this creates a cycle that progressively worsens. The layers that took damage in order were skin and subcutaneous tissue first, then the dartos fascia, then buccal fascia, which is deeper structural layer, then the tunica albuginea, which is the thick fibrous covering of the corpora cavernosa, and in severe cases the erectile tissue itself or the urethra. Beyond 6 hours, ischemia sets in and the erectile tissue starts to die. And our protagonist waited longer than 6 hours because of the nurse and ChatGPT, which completely agreed with him when he said he will lose aura if he goes to the hospital. In this case, surgeons had to deglove the penis, meaning remove his penile skin in order to stitch back his penile blood vessels and repair facial layers. Unfortunately, a severe hospital infection happened, with the main culprits being Staphylococcus aureus entering through the surgical wounds, combined with gram-negative bacteria that somehow ended there. Surgeons started with piperacillin tazobactam, a broad-spectrum antibiotic that covers most of the usual suspects. When that failed, they added vancomycin for the gram-positive coverage and escalated to meropenem, which is essentially the nuclear option of antibiotics. When nothing worked, surgeons made a call to chop his dick off so the necrosis doesn't spread elsewhere. You know that Chinese folktale about a son that couldn't go to war because he got injured after having an intercourse with a horse or whatever? Same applies here, because VC's girlfriend of 5 years never went to a girl's trip to Miami, but actually got flown out by a famous Portuguese footballer after one direct message on Instagram, so VC never saw his girlfriend again and didn't need his tool anymore. Thanks a lot for watching. Stay safe, and I'll see you next week. Goodbye.
You're gonna rip your dick off.